This is The O Factor, a new podcast to educate, inspire, and build trust within our communities. Hi, I'm Dr. O, your host. On this episode, we're going to be talking about the resources that are available to you when it comes to insurance, food, and many other things. You have to pick one, Leti. It's part of the tradition.
Yeah. Mm-hmm. But everyone loves the mattress, I guess. I'm gonna pick this one.
There you go. It's a good one. Especially since we just celebrated Dia de los Muertos. So
yeah.
you can talk
and it's
about
like sad that I'm not using Dodgers, but you recorded that, right?
So today we have another guest with us. We have Leticia Vera here with us. She is the Director of Patient Retention and Engagement at TrueCare, and she leads a talented team of enrollment specialists towards helping community members enroll in affordable health insurance in California and many other services. I think this is something that's really important that we talk about always, but especially now during the times that we are living. So I do want to, number one, welcome you to our podcast. Thank you for being here with us. And, we ask all of our guests to pick a bobblehead. I know that you are a Dodgers fan and they just won the World Series. So congratulations on that. Yeah, I guess that's probably true. But I appreciate and I thank you for continuing the very young tradition that we started about just picking one bobblehead, so it'll be with you for the time that we're talking. What was the reason that you picked that one?
Well, I'm Mexican, and as you know, Dia de los Muertos is really dear tradition for all of us.
I also want to try to hear from you about some of the challenges that you've seen or heard from the community in general when it comes to insurance and just seeking medical care.
Okay, yes, that's a great question. For us, one of the things that we hear, one of the biggest challenges, I guess, is come down to awareness, access, and trust. Many people don't know where to start, what's available, or what they qualify for. And as you know, the healthcare system is very complex, and the application for health insurance can be very confusing. And for many families, also fear or past experiences makes them really hesitant about applying. The other challenges that we have seen is around language barriers or transportation or technology, because as you know, not everyone has access to internet. And even if they do, some don't feel comfortable about completing an application or submitting documents online. And just to add, I think there's also a lot of misconceptions about health insurance, especially Medicaid. And a lot of people think that Medicaid is just only for children or for emergencies, or if someone is working that they don't qualify. And that's farther from the truth. And like, that's not enough. There's also, I feel that there's a lot of confusion about open enrollment and Medicaid.
Yeah, no, I think I see this in the clinic with patients. As we are aware, we care for every patient, and regardless of their ability to pay or whether they have insurance or not. And I wish we were in a world where we could just, as clinicians, just like practice medicine and not have to worry about whether the patient has insurance or what kind of insurance and any of those things. But that is not the world we live in, and we do have to pay attention to that. However, we want to deliver care and have programs and access to programs the same for every patient. That's the same across the board, right? However, I've had conversations with patients that don't have insurance and I ask questions, right? Like, have you tried to get insurance? And I've heard a lot of the things that you're mentioning, and, we'll refer them to your department and like, hey, talk to someone, right? And oftentimes I've had actually a couple of patients that had come back and said I think it was like even a year after, and then they were like, oh, I want to thank you. I was like, oh, how are you doing today? Like, I looked at my note, I saw you like last year for this and that, and they were like, I want to thank you because I was able to get insurance because of you. And then I was like, what do you mean? Like, all, and I mean, I did not remember that part, and I went back to my note and I noted that she did not have insurance at the time, and now she was enrolled in Medi-Cal. And then she told me how, like, during the visit, like, we talked about all the things and I went over the plan, and then she said, and I told her, like, we have our department, and you potentially qualify for insurance. So she did that, and she eventually got insurance, and were able to refer her, because that is a barrier to care, right? Yes. So we can, like, I can place a referral, but they don't have the money to pay for a consult. Sometimes they need surgery, they need procedures and different things. So that comment made my day, although, like, I was there to provide the medical care. Like, a comment I made to her, motivate her to, like, go and see and apply, and that was part of those misconceptions. So I think it's really important that we pay attention to that. And can you tell us a little bit more about how that works? Like, what in that scenario that I just told you, like, if I'm telling a patient, like, oh, talk to our enrollment specialist, like, how does that work, and what does your team do? And when I or someone else refers a patient, or even when we put out there in social media and different venues, and we say, like, hey, we can help you, how does that look in practice?
Yes. Well, like I mentioned earlier, I feel that there's a lot of people don't know where to start. And although there's a lot of resources in the community, obviously I'm going to talk about one that is very special to me, and is that at TrueCare, like you mentioned, we do have an amazing enrollment team. And what we do is making sure that we walk in everyone every step of the way. I always say that we are not here just to do an application, but really walk everyone into explaining what each program means, how do you qualify, completing the application, submitting the application, and not only that, going beyond and making sure that we are following up either with Cover California, CalFresh, or Medi-Cal, to ensure that the application is being processed. So something that I really like, again, like I mentioned, is not that, okay, this is where you can go and apply. No, we walk them through the process, and we do a lot of troubleshoot to make sure that we are removing any barriers for them to being, for their applications to being approved and enrolled, but not only that we're connecting them to care. So it's a very comprehensive, almost like case management that we do, because again, we are not here in the business to just do an application, but the ultimate goal is that our community, our patients are getting enrolled and getting access to the care that they need.
Yeah. I wonder if, throughout your career and the time that you've been doing this, if you have any stories on the other side where, like, a patient has come to you and they said, like, oh, like, thank you, like, I didn't know this was a possibility, or like, my doctor said this or the other. I wonder if there's any, like, what's the other side of the story, if you have anything to share with us.
No, yes, definitely. Like I said, this department has been around for a while, and again, there's other resources, and Medi-Cal itself has been around. But it's amazing how still, again, there's a lot of misconceptions. Not a lot of people understand, because it is a complex program. But I do have a lot of stories that people maybe, sadly, right, that there's sometimes we look for health insurance when we have an emergency or something bad is happening. And we have had those stories that come and they say, I need, I was diagnosed with cancer. I don't have health insurance, and they're just coming here to look for hope, I feel sometimes. And it's really rewarding to be part of that. And sometimes it feels that it's so small, just complete an application, walking that, but it means so much for that person that is on the other side. And again, we work with health insurance, but also even with community resources. Sometimes our family needs food, and we are able to connect them to those resources or apply for even like food stamps as well.
Yeah, and on that note, to sort of close this section, I think it's important in the times that we're living. I had Mimi earlier here, and we were talking a lot about the work we do at TrueCare and how we can help support the community that has the need for food, right? It's something so basic and something
Yes.
that you would think it wouldn't be a problem in this country, yet there's a lot of food insecurity. There's a lot of data and numbers and college students and people
Yes.
like that you sometimes perhaps wouldn't think they are suffering from food insecurity, and I think that's a problem that it's very important because it's directly related to your health, right? So we have different programs that we're working on when it comes to food is medicine or food is medicine, and we really pay attention to the whole person care and the whole
Yes.
spectrum. And so you mentioned CalFresh, right? That's one of the programs that I can, for instance, I'm in the clinic, and if I can refer a patient to your team and say like, hey, they can help you enroll for that. That's something that your team also does, right?
Yes, yes, we are assistant with Medica, Cover California, and CalFresh. Again, our goal is to make sure that we are bringing up those resources that a lot of people qualify. We know that sometimes we have to deal with thinking about having to pay rent, put food on the table. So if we can have health insurance that someone doesn't have to worry about how am I going to cover when my child or when myself I'm sick, but also having that resource for food. Like you said, right, I feel like we can be so naive sometimes just to think that everyone was like, oh, it's so basic, right? But
Yeah.
not everyone has,
Yeah.
the same resources.
Yeah, that is unfortunately not the case.
Yes.
Well, thank you so much, Letty, for being here with us today. Thank your team and everything that they do. I think we can talk for hours about like different stories and everything
Yes.
that we've seen on both sides, but I think it's work that's really important. And as I was talking with Mimi earlier, um, your team and the work they do is part of TrueCare and what we do as a whole, and
Yes.
none of us would be able to do our jobs without every single department and every single person that works at this organization. We'll work together for the same purpose. So thank you
Yes.
for being here,
No,
and thank
you.
your team for everything they do as well.
No, thank you.
There's a lot of misinformation and misconceptions are out there, and people get a lot of information from various places. During this time, I would like to bring attention to a couple questions that I've been asked in the past, and I want to sort of clarify and provide some information around them. So, one of the questions that I often get is, what are some ways I can manage stress at home? There's different things that we can do, such as deep breathing. We can go for a quick walk, we can stretch for a few minutes, or we can practice gratitude, as we were able to discuss during this episode as well. Meditation is something that helps, and then just sticking to a good sleep schedule is something that can help us along the way, and also eating balanced meals. If you put all those things together, or if you even pick a couple of those are some strategies that can help you manage the stress at home. Another question that I want to address is, how much water should I drink every day? This looks a little bit different for every person because it depends a lot on your personal history, your medical conditions, and but for most people, aiming to somewhere along the lines of 8 to 12 cups of water or 2 to 3 liters, that is something that can bring you some ways to prevent dehydration and just make sure that you are able to at least introduce some sort of water fluid intake throughout the day. And then the last question is, does eating right before bed cause digestive problems? So this is a very, very common question, and depending on the medical conditions or the problems that you have, it is something that you'll need to pay attention to. Perhaps a small snack is something that can be okay, but I wouldn't recommend having a heavy meal right before you go to bed, because that can cause heartburn and just poor sleep and many other things. I would recommend that you make every attempt to have your last meal like 2 to 3 hours before you go to bed. I think it'll be something that everyone is different. We have different routines, but if you can aim for that, would probably bring you some benefits to your health. Before we wrap up, I just want to leave you with 3 simple tips. Number 1, practice micro breaks for stress. You can take 1 minute every hour to stand, to stretch, to simply take deep breaths. I think that's something that can help you. Studies have shown that taking breaks will help you reduce tension, improve your focus, and then also lower levels of stress in general. Number 2, I would spend some time in nature, even 10 minutes outdoors. Oftentimes we're inside an office for most of the day, and I think it is important that we just go outside, take some fresh air, go for a little walk. That's something that can really improve your mood and just overall help you with being more creative perhaps at work. And number 3, I recommend that you get more sunlight. Something as simple as stepping outside for 5 to 10 minutes soon after you wake up, or just something opening the window, letting the sunlight come in and early in the morning. And I would highly recommend that you do this before you start looking at your phone. Oftentimes we wake up, first thing we do, look at the phone, and that light isn't very helpful, and also when you go to sleep. So just natural sunlight in the morning, it's something that I would highly recommend. Thank you so much for tuning in. Remember, insurance, no problem. TrueCare keeps health within reach.